Hello everyone. If you've got issues with pain in your hands or tingling or numbness, then you might want to stick around because today we're going to chat about carpal tunnel syndrome. This is Dr. Lisa here and Dr. Britt over there.
Hi guys.
And we're chiropractors at Errol Street Chiropractic in North Melbourne. And over the last couple of months we've been answering lots of questions that patients come to us with. So one of them is carpal tunnel syndrome.
Yeah.
So today we're going to answer what is carpal tunnel syndrome, what are the symptoms that you might get if you've got carpal tunnel syndrome, how do you diagnose it, and what kind of treatment is available, and what we can do as chiropractors as well to help. We're also going to go through a few stretches for you to try if you think you've got carpal tunnel syndrome in its early stages and you might want a bit of help. So, well, firstly, what is carpal tunnel syndrome?
Yeah.
Britt?
So, carpal tunnel syndrome. So firstly, our carpal tunnel is a passageway that runs through our wrist here. So when we look at the palm surface of our hand, it's the tunnel that runs down here through our wrist. And through that tunnel, we also have the tendons that come down our forearm and flex our fingers. So our flexor tendons run through that tunnel. And we also have a major nerve called the median nerve, which supplies the palm surface of our fingers the sensation and movement through that hand. So carpal tunnel syndrome is when there is restriction in that tunnel, so it can come from inflammation. And then what happens is the tendons become inflamed in that tunnel and in turn actually compress the median nerve. So it's all about compression and inflammation in that tunnel on the median nerve. That's what carpal tunnel syndrome is.
Well done, well done. So carpal are the little bones in the hand.
Absolutely.
Tunnel makes sense. Okay.
Yeah.
And it's pretty much the nerve in there.
Yeah.
Gets irritated. So, so what are some of the causes of carpal tunnel syndrome that we know about? We see in the office. We see lots of pregnant women here, so pregnancy is a big one.
Yeah, that swelling, a bit more fluid retention can cause irritation on that nerve in
What
that
else?
tunnel. It can be, so if you're somebody who potentially does a lot of activities with a lot of repetitive movement through the wrist and the hand, that can over time cause that inflammation, especially if you're holding your wrist or your hand into a flex position for a period of time or an extended position. So whether it's you play a sport or you just, you do a type of occupation that requires you to hold your hand in that position for a period of time, that can cause it. There is a hereditary thing which I actually found during my research for this, that you can actually have a altered space through that wrist that can cause that tunnel to be more prone to that inflammation. So it can be a structural abnormality which tends to run in families, which was a bit of an interesting one as well. Yeah. People who do a lot of scribing on the computer as well, where you're just sitting there for a long period of time just typing and scribing, I find for a lot of patients who do a lot of that, that tends to be a common thing as well.
Yeah. So what are some of the symptoms then, Britt? So when people come in and for a long time, and this is what we hear quite a bit. So this is before they'll get diagnosed. One of the things that we see and hear are patients complaining of waking up with that dead arm, dead hand in the night. So that can be an early sign. So what else do we see?
You can just have pain in your hand. You can actually have a loss of sensation. So you might find that you've got a bit of numbness through the first three fingers, so your thumb, your index, your middle finger, and a portion of your ring finger can be numb on that palm side. You can have tingling in your hand, weakness as well, like trouble gripping things. A lot of that, just that consistent pain. Especially if that numbness has been there for a bit, you can actually get some circulation problems as well.
Yes. And that the tingling and numbness can also be all the way up, even into the shoulder, because of that pressure on that median nerve. So, and they can persist for quite a while. It can be mistaken for many things as well, especially with nerve issues in the neck. So that can actually aggravate it. And there's a issue hypothesis which we call double crush. So basically the nerve can get irritated in a couple of places. So it can have a bit of pressure on the neck, and obviously then in the hand. So how do we get this diagnosed? So the diagnosis of a carpal tunnel, once we've ruled out other things, then even in the office we'll do a couple of orthopedic tests to see if there's pressure on the nerve. There's like a nerve tap. We can do a Fallon's test to see if there's stress, or we hold certain positions to see if that aggravates and closes that that carpal tunnel.
Brings on your symptoms.
Yeah, and that can bring on the symptoms.
Yeah.
So there's a few orthopedic tests that we can do. We do a carpal compression as well. But if we find that things are getting worse and they're not improving, then we may need to go and get things like some imaging, like an ultrasound. You may need a nerve conduction test. And so hopefully, obviously, the whole objective is to avoid any kind of surgery. But
for some people, it's unfortunately, if it's quite severe, it does get to that point, and it's important if it is quite severe to be having that surgery because it can create irreversible damage in the nerve if it's left compromised for a period of time.
Absolutely. Yeah. So Dr. Britt's got a few stretches.
Yes.
Yeah. So obviously if you're very flared up with any kind of carpal tunnel symptoms, you don't really want to be doing these, or you might just want to try really, really, really gently.
Yeah.
But obviously if anything is aggravated, then just, stop doing that.
And if you do suspect that you do have carpal tunnel, the first thing would be to go and see a healthcare practitioner and get that assessment and diagnosis first. But these can just be helpful if you are just feeling a bit sore or achy through the wrist, and you are just getting a little bit of that tingling, just really mild symptoms starting. These are a nice way just to help take some pressure off and keep your symptoms at bay. So they're really basic and they're easy ones that you can do day to day when you're sitting at your desk or even when you're sitting in the car at the traffic lights.
Good idea.
So they're just wrist flexion and extension exercises. So you can just flex forward and just pull your fingers down, and you're just getting that stretch through that top part of the wrist there. So you can hold that for about 30 seconds. I always advise, even if you're not getting pain on the other side, it's just worth evening yourself out and doing both sides. And then you can turn it around and then do your extension, which then will give you that nice stretch through that front part or the palmar side of your wrist and into your forearm as well. I tend to find this, I get a bit more up through my elbow when it's really tight. And the same thing, do both sides and hold for 30 seconds. And the other one is a prayer stretch, which is really nice. So have your hands in a prayer position, bring it towards your chest, and you want to have your forearms nice and straight. And the aim is to come, so you can start up a bit higher, and the aim is to come down as far as you can towards your hips. Because the further you go down, the more stretch you start to feel through your wrists as well. And it's the same, you could just go really gradually down for over a count of 20 seconds.
And in terms of what we do as chiropractors in the office is that we will obviously give some stretches, but we'll be looking at relieving any tension that might be happening at that cervical level. So if there's any areas that in the joints of the neck that are restricted, that could be irritating the nerves that are going down into the hand, then that's how we can help. We also just help to ease those muscles around the upper back and shoulders where the nerves will go through as well.
And even just doing some mobility work through the wrist as well, working on your carpal bones and just that motion through your wrist and your elbow, so working on your extremities as well.
And just checking posture.
Everything,
Checking your posture at work and home if you're sitting at the computer, and if there's anything that might be aggravating you at work, seeing if we can modify any of those activities and any of those postures.
I forgot to mention, you can actually get some wrist support for, that actually is specific for carpal tunnel syndrome, and that can be really helpful if you are somebody who needs to be continuing those work and those postures that could be aggravating. This is just a nice way of potentially just taking some pressure off your wrist while you're in that inflamed state as well.
Yes, absolutely. So lots there, guys.
Yes.
So, and if you know anyone that's got issues potentially with carpal tunnel, then do pass this on.
I feel like it's a very common thing. I feel like we talk about it at least once a week here in the practice.
Oh, absolutely. We do see quite a few cases. So, and also if you'd like to like our page or on Facebook or Instagram, please do. We've got lots of similar information about how to look after yourself. Thank you for listening, everyone. Thanks, Dr. Bruce.
Thanks, Lisa.
And we'll see you all next time. Bye for now.